This video is based on a presentation I gave at the Zoomer Life Conference in Toronto on October 27, 2011. Rapid Aging Syndrome. What is it? What causes it? What can we do about it? You would think that the information I'm presenting is top secret. It is not taught in schools. It is not discussed by Health Canada. Most doctors are unaware of it, and it is not part of the evening news. I'm not referring to rapid aging on the outside. I'm referring to rapid aging on the inside. Symptoms include poor sleep, confusion, chronic fatigue, chronic pain, anxiety, depression, and a host of other symptoms that we treat with pharmaceuticals. In 2001, a study conducted in Spain examined symptoms experienced by people living at various distances from cell phone towers. Now you might ask, who lives this close to cell antennas? The answer is quite a few people. These antennas are constantly transmitting microwave radiation. The top floor of apartment buildings often have the highest exposure. According to the Spanish study, people who live within 300 meters of cell towers have an increase in these symptoms. Collectively, these symptoms are called electro hypersensitivity. The symptoms in red are the ones we experience as we age, so I prefer to call this rapid aging syndrome. Indeed, many people who are electro-hypersensitive attribute their symptoms to aging or living a stressful lifestyle and have become accustomed to chronic ill health. The source of the electro-smog in the example I provided comes from antennas, but we use devices on a daily basis that also expose us to this radiation, including smart meters. If we could hear this radiation, this is what it would sound like. Do you notice anything unusual in this picture? The plants near the smart meter are not nearly as healthy as those further away. Electrosmog has also been associated with degenerative diseases like diabetes, various neurological disorders, heart problems causing an irregular or rapid heart rate, blood disorders. It's been shown to affect sperm, and it has been associated with various types of cancers. Degeneration starts at our cells, and here is an example. I took a blood sample, placed it on a slide, and placed the slide under the microscope. This is what my blood looked like in my home, which is electromagnetically clean. After I used a computer for 70 minutes, and after I talked on a cordless phone for 10 minutes. The blood cells are sticking together and resemble a stack of coins. This is called rouleau formation and indicates unhealthy blood. It reminds us that aging starts at our cells. Here is another example of how electromagnetic energy can affect blood cells. This time I laid on a mat that emits pulsed magnetic fields. After an 8-minute treatment, instead of my blood clumping, most of the cells are free and are not sticking together. This enables maximum surface area for gas exchange. It turns out not all electromagnetic fields are the same. Healing also starts at our cells. I first began to study the harmful effects of electrosmog. Recently, I became interested in the beneficial or electrotherapeutic effects of electromagnetic energy. This is the yin-yang of electromagnetic exposure. I teamed up with Bob Conley, and together we traveled to various places in Europe and North America and interviewed scientists, doctors, engineers working with pulsed electromagnetic fields for a documentary we are producing. Here is a peek at some of the information we have gathered so far. Pulsed electromagnetic fields, PEMF for short, have been used since the 1970s to heal fractured bones. Today, we can buy portable PEMF devices that we attach to our body to accelerate healing and relieve pain. Veterinarians use these devices as well. Healing bone fractures was one of the first uses of pulse magnetic therapy recognized by health agencies in North America. We then went to Liechtenstein and visited the chief executive officer of BEMER. They produce mats that emit pulse magnetic fields. While we were there, we were introduced to the work of Dr. Rainier Klopp at the Institute for Microcirculation. Dr. Klopp is able to document live blood cells moving through blood vessels in the body using real-time videography as shown here. The blood in some vessels is not flowing smoothly. It looks like a traffic jam. This is what the microcirculation looked like after a BEMER treatment. The blood is now flowing smoothly. You can see it again here, before treatment on the right and after treatment on the left. A treatment that improves circulation is going to benefit the entire body. The BEMER also affects the behavior of white blood cells. White blood cells are an important component of the immune system. After treatment, the white blood cells can be seen crawling along the inside wall of the vessel, which enables them to better detect receptor sites that indicate infection. Here is rare footage in slow motion showing one white blood cell migrating into the surrounding tissue. What does this mean? We have evidence that exposure to therapeutic pulsed electromagnetic fields reduces blood viscosity, improves blood circulation, benefits the immune system, promotes healing of bone fractures, fights depression, and reduces pain. Pulsed electromagnetic fields are used to help people with many different conditions. However, PEMF devices do not treat a specific condition. Instead, they optimize the body's natural self-healing and self-regulating functions. Why is this not common knowledge in North America? While we can benefit from good frequencies, we need to reduce our exposure to bad frequencies if we want to maintain or regain our health. The information I present in this video is both disturbing and encouraging. Within the next 5 to 10 years, the information I present in this video will be self-evident. Indeed, some believe it already is.